There was a conference in Venice in November 1981 on tobacco and young people. And there were researchers from many European countries, and we discovered that we had a lot in common. We were interested in young people, and not only tobacco, but in their lifestyles in general.
We were talking about comparisons between Norway and Finland, and then Austria and England joined to that discussion.
Then the idea came up to start a collaborative study, a cross-national survey on health behaviour in school-aged children. So we did.
When I joined the study, there were about 10 countries involved, and then when I took over as coordinator, there was about 15 countries involved.
The World Health Organization became interested in the study. Through discussions with them, it was decided to make it a WHO collaborative study. That was very important because it led to recruitment of new countries, the expansion of the study, and it had a more important standing internationally.
Now the study is 43 countries, around 450 members, so you can imagine the sort of communications we need now are a lot more sophisticated.
It has actually been growing to cover almost all European countries, and that is an enormous strength, especially for these international comparisons and to show the differences of Eastern and Western Europe, to show the differences of South and North of Europe.
It's more challenging because you have to meet all these new people, all this different background, but it's more and more rich. It gives you more and more because the people are so different, they're coming from different countries, different disciplines, and you have young researcher, older, so it's getting more and more alive and interesting.
At the time that HBSC started, you weren't used to asking children about their health and their health behavior and give themselves a voice to tell about that. You would usually ask the parents, but HBSC asked the children about their health, about their health behavior and about their well-being.
HBSC is about finding out more information about the lives and the health and well-being of adolescents. So we embed health within a much broader framework of all the social factors that determine the well-being of young people, so their family, their schools, their friendships, their socioeconomic status.
Schooling age is not just getting an education which improve your chances on the job market, but also how you will be able to be a partner among the people, so social networking, this kind of things. Also your self-esteem, your self-confidence and all these kind of things which will really influence all your life, happiness or unhappiness. Some things similar for the ages, but some of them are changing very, very dynamic. For example, now electronic media change a lot of things very dramatically. So it's not enough to know what was true 10 years ago. We need to know it regularly.
It's very powerful at a number of different levels. We've seen the way in which it's been used at a national level to influence policy and programs, for example, in physical activity, in obesity prevention, and bullying prevention, but also at an international level, in collaboration with our partner, the World Health Organization. We've been able to show examples from countries of where the data has been powerful in creating change, and taking that to an international level, talking to health ministers about it and saying, look, this information is incredibly important for guiding what you do to promote the well-being of your youth.
The HBSC is the only data source we have for the health and well-being and the social indicators of adolescents throughout the region. So we're using as much of it as we can for providing policy advice to the ministers of health and ministers of education throughout the WHO region.
They use HBSC to know more precisely in what class to do health promotion, for example, and that is really important.
We know that Scotland has an unhealthy relationship with alcohol, and the research that HBSC has shown that that is still the case and reaffirmed that knowledge, and has allowed us then to take policy initiatives forward. For instance, we've got the alcohol framework, which has a package of measures designed to rebalance the relationship that Scotland has with alcohol. So we've piloted test purchasing, we've tried to crack down on selling alcohol to under 18-year-olds, and a whole host of other measures to try and make sure that we can move forward as a country with a much better relationship with alcohol and making sure that our health is much better in the process. So that's a really tangible example of the importance of HBSC's work.
Last year we developed a few programs in collaboration with the Ministry of Education, Ministry of Health, Ministry of Social Affairs as well, even with the police as well. And in all these kind of collaborative works you may meet, really, you can see the results of HBSC as baseline data for further interventions.
There is a lot of interest in the study, in the findings of the study. You regularly see news that stem from the HBSC study. Sometimes it's not explicitly stated that it comes from the HBSC study, but I recognize it because I know the study so well. So obviously it is very widely communicated. It has a very good mass media coverage. In the beginning, we had no idea how large the study was going to be and how successful it was going to be. We had the idea that this study should have a starting point but no end. It should go on forever. We also had the idea that we didn't want to limit the study to a particular number of countries. We could expand as long as there were new countries interested in joining.
The challenge for the future is not only to continue the study, to find the funding and support for the study, but also to look at children whose lives are on the margins. So we work with school-aged children, school children who are in school, but many children don't achieve that.
I hope that we will be able somehow to inspire and work with countries from the third world and from other parts of the world who are interested in and who needs the kind of knowledge that we've been building for our countries.
I do hope that we will be able to expand the survey into more countries, but also that we will be able to expand maybe the age range beyond 15 and also below 11.
That we can manage to ask the survey of all kids in the country. That is, not exclude any particular type of kid because we assume that they won't be able to fill in the questionnaire.
To find out how migration impacts well-being in the life of children, their living condition, HBSC could be very important.
I feel really proud of the study. The members give an enormous amount of their time and their thinking and their efforts to creating a common product which takes the research right from the moment where it's conceived right through to collecting the data, analysing the data, writing papers and reports. And the energy that requires and also the extent of cooperation between countries is really quite extraordinary.
Different countries, different type of people and different professional backgrounds and so on, coming together for one special interest, and that is to actually try to improve the lives of young people, and in being able to do that in this way is really it's still exciting.
It's very nice feeling when all of us understand that this is not the end at all, this is a start, so the next 30 years will be very interesting.